Good evening, and thank you for joining tonight's Teletown Hall meeting with Congressman Andy Barr. Congressman Barr will be joined by Ambassador Kelly Craft. A Kentucky native, Ambassador Craft has served in the position of Representative of the United States of America to the United Nations since 2019 and will provide an update on the international response to COVID-19. In just a moment, Congressman Barr and Ambassador Craft will begin with a few remarks to give everyone time to join the call. This technology allows people from around the 6th District to join us live to ask questions from your congressman. If you have a question for Congressman Barr, please press star and then 3 on your phone. Again, that is star and then 3 to join the queue to ask a question. With that, I'll turn it over to Congressman Barr first to update us on the federal response to coronavirus, and then to Ambassador Craft to share about her coronavirus response work as America's representative to the United Nations.
Thank you, Tatum, and good evening, everyone. Thanks so much for joining us for this important update on the response efforts to the COVID-19 pandemic. I know it's been a tough few weeks for everybody out there, but we really do appreciate everyone and what everyone is doing out there, especially our heroic and selfless doctors and nurses and healthcare workers who have put their own health at risk in our hospitals, serving other people. Their courage has really been on full display as we fight this novel coronavirus together. And I also want to thank so many of Kentucky's unsung heroes. You know them, you see them going to work every day: police officers, firefighters, paramedics, grocery store employees, the truck drivers, the postal workers. Our bank tellers are working so hard right now, and sanitation workers and cleanup crews, despite the danger that the virus poses to them. And I know you join me in recognizing their sacrifice, which keeps our community maintain some sense of normalcy during these difficult times. I also want to thank Ambassador Kelly Craft for joining us tonight. It's really special to have a Kentuckian join us on the call, but a Kentuckian as important as Kelly. Ambassador Craft, as many of you know on this call, she's a native Kentuckian from Barron County, Glasgow, Kentucky, but she's lived in Lexington for a long time. She's part of the Big Blue Nation. She's a University of Kentucky alumna, and we're so proud of her because now she's ambassador to the United States of America, to the United Nations. And before that, you may know, she was ambassador to Canada from October 2017 until the assumption of her role at the United Nations in 2019. And during her time as ambassador to Canada, she worked through the complex revisions to the NAFTA treaty and helped navigate our country into what is now known as the United States-Mexico-Canada Agreement, or USMCA. She's a leader, she's an entrepreneur, a philanthropist, a public servant. She's made our community so much better, and her service improving education and our national security is now the cornerstone of her career. So we're really lucky to get her perspective on the UN and the global response to the pandemic. Let me first give you all an update on the Congressional federal response to what's going on here. Last week, as you all may have read in the news or seen on TV, the Congress passed, with my support, a bill which was really the fourth bill in a 4-phase congressional response to the COVID-19 pandemic. Last week, the bill was called the Paycheck Protection Program and Healthcare Enhancement Act, and this bill replenished the Paycheck Protection Program, or PPP program, which was part of the Phase 3 CARES Act, and it provided $310 billion in additional funding and allocated $60 billion in funding for the Small Business Administration's Economic Injury Disaster Loan and Grant Program. This legislation also provides $75 billion in funding to support the work of our hospitals and our heroic healthcare providers in their fight on the front lines to defeat the pandemic. Finally, the package included $25 billion to expand testing to help us safely reopen our economy. For weeks, we have been calling on Congress to provide additional funding for the PPP, which has saved millions of small businesses from closure and kept their employees on the payroll. And in the first wave of that funding, 1.6 million small businesses, including many here in central and eastern Kentucky, received loans. including 24,000 loans approved totaling over $4.1 billion here in Kentucky, according to the Small Business Administration and the United States Department of Treasury. In addition, 74% of those loans from that first wave of funding were under $150,000 in value, indicating that the overwhelming majority of these forgivable loans went to the smallest of businesses. Almost 20% of the loans were processed by small lenders, banks in our communities and credit unions with less than $1 billion in assets. And approximately 60% of the loans were approved by banks with $10 billion in assets or less. These are truly the community banks, not the big banks. And no lender accounted for more than 5% of the total dollar amount of the program. So the program really is not a bailout for big businesses. It's for Main Street mom and pops. Finally, I've created a small business response team in my Lexington office that's available as a guide for small businesses in the 6th District that have questions about any of these Main Street lending programs. They are working with impacted businesses and our lenders to liaise with the Treasury and the SBA on outstanding issues. If you need help, feel free to call our office. We can help you with one of these forgivable loans. As a reminder, and for those of you just joining the call, you can get into the queue and ask a question by pressing *3 on your phone. You'll be put through to an operator and you'll be placed in line to ask a question. Now, to give you just a brief update on COVID-19 cases nationwide in Kentucky as of tonight, Tuesday, April 28th, over 1 million Americans have tested positive for the COVID-19 illness, with over 4,100 cases in Kentucky. Over 57,000 Americans have died of this illness. At this point in time, Kentucky accounts for less than 1% of all confirmed COVID-19 cases nationwide. And I was on the phone this afternoon with a number of emergency room physicians from across the Commonwealth. And what they report is that our hospitalization rate in Kentucky appears to have stabilized. And in fact, we look like we're on the downslope of new confirmed cases, and that is a really good sign. So we've succeeded in flattening the curve, but it's vitally important that all Kentuckians remain vigilant and that leaders continue to prepare the state for more cases. We want to open and reopen this economy as soon as possible, and I think we're getting to the place where we can do so consistent with public health. And I continue to work diligently to make sure Kentucky has the resources it needs to fight the virus. Last week, we secured much-needed clarity on the use of telehealth services in hospitals from the Centers for Medicare and Medicaid Services, an agency that's also called CMS. In my office, successfully advocated for same-location telehealth services to help COVID-19 patients protect healthcare workers and conserve critical personal protective equipment. CMS provided guidance at the request of our office that to the extent a medical service can be performed via telehealth, when the locations are different, the same technology can be used also within the hospital. And what this means is that if the patient and the doctor furnishing the care are in the same institutional setting like a hospital, but they're using telecommunications technology like a Bluetooth stethoscope and an iPad to keep socially distant while still furnishing the service but also reducing exposure risk, the doctor does not need to report that service as telehealth and should instead report that as a face-to-face code for the in-person service furnished. That's important because it allows providers to do this more often and protect themselves, their nurses, and also save very scarce personal protective equipment. CMS has now clarified this policy in place, and providers can contact their Medicare Administrative Coordinator with any questions. And I must give credit for this change in policy to a Lexington epidemiologist, Dr. Mark Doherty, who is really a nationally renowned epidemiologist, infectious disease expert, who brought this to my attention. He's one of many healthcare providers in Lexington on the front lines battling COVID-19. And upon hearing his interest in using same-site telehealth, our office worked for clarification and promoted this solution to CMS. And this is a really, really important innovation for doctors and nurses combating the COVID-19 across the country. Also, I'll note that last week the Department of Health and Human Services continued distribution of the $100 billion authorized in the CARES Act for hospitals. This is very important money that's going to help our hospitals and our doctors and our nurses combat this disease. And we continue to work to provide those folks with personal protective equipment and testing. We've been coordinating and advocating with FEMA, with HHS, with the Assistant Secretary for Preparedness and Response to ensure Kentucky receives those medical supplies from the Strategic National Stockpile and from other sources for our hospitals and healthcare workers. And also last week I had a call with Dr. Tammy Beckham, who is the head of infectious disease at the U.S. Department of Health and Human Services. She's really the number 2 in the supply chain task force for testing across the country. And we really had a good call with her. We were able to advocate the needs of hospitals in the 6th District for more testing supplies. And she was very, very helpful with that. So I want to thank her. The final point that I want to make before I turn it over to the ambassador is something, a passion that we share, and that is how do we counter China in dealing with this pandemic? I recently introduced House Concurrent Resolution 97, which is legislation establishing a bicameral, bipartisan joint select committee to investigate the origins of and China's handling of the 2019 novel coronavirus. The legislation directs the committee to conduct an investigation and issue a report to the House and Senate on findings regarding important issues like the origins and causes of the virus, including evidence that it originated in the Wuhan Institute of Virology laboratory, as well as China's response and cover-up of the outbreak. China's suppression of information, its propaganda and disinformation campaign, including putting out conspiracy theories like the United States military caused the spread, when in fact it was China's own denial of humanitarian assistance by foreign governments and NGOs and charitable and faith-based organizations, its silencing of whistleblowers like Dr. Lee and making him sign a statement recanting his sounding the alarm of this very dangerous and contagious pneumonia-like virus in Wuhan hospitals in December, and China's actions to influence the World Health Organization and the WHO's repeating of the Chinese lie of no human-to-human transmission. And I look forward to hearing Ambassador Kraft talk about that. Also, China's efforts to manipulate and weaponize the global supply chain. We know that after they knew this was a global pandemic, they began to vacuum up all of the personal protective equipment and the critical pharmaceutical components, which is why Congress needs to look at relocating our supply chains back domestically. And then the legislation calls for the committee to make recommendations to improve and secure the United States access to critical medical supplies and pharmaceutical components in the medical supply chain. The committee would be composed of 20 members of Congress, 10 from the House, 10 from the Senate, bipartisan, one co-chair from each chamber. And here's the bottom line. The Chinese Communist Party put us all at risk. The American people deserve answers to basic questions about the origins of this pandemic and China's deceptive and destructive behavior. We believe that Congress needs to exercise its oversight responsibilities, expose the truth, and hold China accountable. The legislation already has over 50 co-sponsors in the House, and I look forward to working with my colleagues to show a unified and bipartisan effort to getting to the truth about this virus. So, look, I know this has been an emotional and difficult time for everyone, and we will continue our efforts to protect our state and ensure that the great American comeback on the horizon is engineered by the action we take during these difficult moments. I continue to seek your feedback and ideas as we continue to advocate for your interests in Washington. We look forward to your questions. And now I want to turn it over to Ambassador Kraft for her remarks. Thank you, Ambassador Kraft, for your time while representing the voice of the United States on the world stage. Please proceed with your comments.
Thank you so much, Congressman. As you all may not know, Congressman Barr is my congressman from the 6th District, so I'm especially proud to be able to share this evening with him. And I'm really happy that I'm also here with my fellow Kentuckians who are on the call. So thank you all for those of you who have tuned in. And for those of you who don't know, I've known Andy for many, many years now. And as always, I am so impressed by your leadership, Congressman, and your thoughtfulness, and especially the sound, solid commitment to the people of Kentucky. So I just want to thank you from, 3 neighborhoods away, I think, for your notable service that you're giving to the 6th District. And also, we as Kentuckians are so fortunate. We are really fortunate during these challenging times that we have Leader McConnell, who has shown nothing but exemplary leadership, and not only for the state of Kentucky, but for the citizens of this great country. And you have been by his side supporting him. You have been walking through a lot of the issues and bringing home and delivering those very clear with a lot of clarity to Kentuckians. So I'm very grateful. And, you know, without our governor, Andy Barr, he has really done a terrific job guiding Kentuckians through this very difficult time. And I can say that the impact of all of you all, of all your work, has never been clearer than it is today. And so I'm especially grateful. And I also just want to make one comment that I grew up on KET, and I just want to tell everyone that how saddened I am today to hear about Lillian Press's passing, because she, just like you, Andy, was such a public servant to Kentucky. So more than ever, being here in Kentucky during this shelter in place, I know that I am in love with Kentucky, but this love affair just continues to grow, and I've just never been so proud to be a Kentuckian. So Congressman Barr has asked me to provide you all some updates on what we've been doing at the international level as we respond to COVID-19 pandemic. So I'm going to touch on just a couple topics and then leave a lot of room for questions. But here's what we know. 26 million Americans are out of work because of this virus. 56,000 Americans are dead because of this virus. Here in Kentucky, as the congressman has reported, there's been over 200 deaths. And, you know, I wish that we weren't having to discuss this with China, but had China been transparent and been forthcoming about the virus, their time that they led us astray has cost lives not only in Kentucky but all over this wonderful nation and on a global standpoint. As the ambassador to the United Nations, I'm in charge of this most incredible team at the U.S. mission. So it's called the USUN, and I'm just going to mention a few things that we've been doing to help coordinate a global response to the pandemic. And this shows the leadership of the United States and the Trump administration to the world. So back in March, when we first were really alerted to the seriousness of the virus, the U.S. mission, we helped coordinate the transfer of 250,000 protective face masks to the state of New York. If you remember, New York was Governor Cuomo, who was just really desperate and pleading for protection equipment for the first responders who have been incredible at keeping this virus mitigated in New York City. We were able to take 250,000 of these masks and give them to the medical professionals in New York. It was just a very small way to show that the United Nations, we may be a home to 103 different nations, but we are all New Yorkers. And we all rely on the American healthcare system, the best in the world, especially during this crisis. So I think a couple things that I have found that have been very important in my day-to-day work with the United Nations has been communication. And that has been paramount. And obviously you go back to China and you think about the lack of communication that we have had with China, the lack of transparency. And without the communication and the transparency in our daily briefings in the state of Kentucky, with these town hall meetings with Congressman Barr, with his daily tweets, his daily Facebook, with President Trump and our White House task force, without us being transparent and also holding us accountable, we would never have the progress that we have seen in mitigating this virus. So I think it's really important now that everybody is on the same page. I'm on the phone several times a day with our Secretary General. So my job is a little different as far as dealing with just one entity altogether. So when I speak with the Secretary, we are talking about different different diplomatic counterparts from other countries and how we can best help them mitigate the virus. We are especially concerned at this moment with the African continent. We've got the countries in Africa that have yet to see this virus really come into full-blown effect as we have in the U.S. And as you all remember, Africa was affected by Ebola, as they still are, but we are in hopes that the lessons learned from the Ebola virus will help Africa to best mitigate and also to understand the vaccinations and the preventative measures that we will be trying to introduce to them, that they'll understand that this is for their livelihood and to help stop spreading the virus throughout the continent. We have been working daily with the Security Council. There are 15 members on the Security Council, and there are permanent 5 members, so that they're France, China, Russia, the United Kingdom, and the United States. And we are the permanent members. So as you can understand that, not everybody likes one another in your own family around the dinner table, but you've got to get along. So out of respect, obviously, I work with the Chinese permanent representative daily, and I have to show him respect. We do know where we both disagree. He understands the way I feel, the way the Trump administration, how Americans were misled, and we just try to mitigate around this. And at the moment, what we are working with within the Security Council is a resolution to emphasize what the Secretary General, Antonio Guterres, has stressed, which is a global ceasefire. So you can visualize if you've got, an area in your state or where you've got a lot of unrest, then when you try to go in and help people, you can't really get first responders in there. So we are trying to stress to countries that, especially emerging countries that have a lot of conflict, whether it's Syria, Yemen, Venezuela, a lot of the different countries that you're seeing, Iran, different areas where you're seeing a lot of conflict. If we could have them have a ceasefire, then we are able to get first responders, whether it's UNICEF, the World Food Program, USAID, and also a lot of the peacekeepers to go in and be able to help teach them how to best practices, whether it's simple things that Kentuckians do so well, which is wash your hands and the social distancing. Well, if you tell people in a refugee camp, let's practice social distancing, trust me, I have seen these camps and they wish they could, but there is not enough room for social distancing. So we have to figure out ways through each country how we can best mitigate and help the refugees and the citizens of those countries to stop the spread of this virus. So those are just a few little things that we're working on. We worked on Venezuela within the Security Council and just the importance of this Nicolas Maduro regime and how he is not protecting his very own citizens of Venezuela, and how the United States, as always, Kentucky taxpaying dollars, everyone's taxpaying dollars in the U.S., are spent helping others. We are the first ones in, and we are the last to leave. And each of us, while we are sheltering in place, needs to hug yourself, because of you. We are saving hundreds, thousands of lives all around the world. But today, not everybody agrees with the way that each country may want to combat the virus, or the way that they are narrating the virus. So within the council, we have to be very thoughtful of one another. But as the U.S. ambassador and a Trump appointee, and someone who knows that the State Department and the president completely has my back, I am able to fight on behalf of all Americans, because I owe it to each American, to all of my Kentuckians, that your tax-paying dollars are spent very wisely, and that we help those here at home first, and then we are able to best help those abroad. So those are just a few things. I was ambassador to Canada, and negotiating the NAFTA, which is now today USMCA, really taught me well negotiating with 192 other member states. So I've never been so proud to be a Kentuckian. I'm reminded every single day when I am in the Security Council, my upbringing, I grew up on a farm in Barron County, and my upbringing to know that, you treat all things equal, and the importance of understanding everyone has a place in life. So I owe it to the American people, and I'm so confident when this is over that our children and our grandchildren are going to be better prepared, because this is not going to be the last pandemic that we all face, but we are going to be prepared, and we're going to leave our country better prepared for the next time. So I'm going to stop with that and just give everybody time for questions. Congressman, thank you so much for letting me have this opportunity. It's just, I can't tell you how special it is to be able to be home and to be sheltered in place. And there's so many silver linings, and one is which is I've got to spend time at home in Kentucky. So thank you for inviting me. And I will turn it back over to you.
Thank you, Ambassador, and thanks for that great update. And we're it's fascinating to hear you talk about your interaction and your diplomacy with the Chinese and with all of the other nations, and we're very grateful for your leadership there. And I'll turn it over now to Tatum to start the Q&A.
Yes, thank you, Congressman and Ambassador Kraft. As a reminder for those of you just joining the call, you can get in the queue to ask a question by pressing *3 on your phone. You'll be put through to an operator, and you'll be placed in line to ask a question. Again, that's star and then the number 3 to ask a question. With that, we'll open it up for questions. Our first caller is Jonathan from Frankfort. Jonathan, you are live.
Hey, how you doing?
Hey, Jonathan.
We're great. How are you tonight, Jonathan?
Doing great. How are you guys doing?
Doing well.
I'm enjoying my time at home in Kentucky, so I'm making the best of it.
Absolutely fantastic. Well, that's exactly what I'm doing right now. Spend time with the family and just staying home like we're supposed to.
Well, you're part of the cure, because I think everybody, we all are part of mitigating this virus. So each of us that stays home and each of us that practices social distancing, as Congressman can tell you, he does so well also in Washington. We all are part of the cure, really. So thank you.
Well, needless to say, I'm sure everyone's getting a lot of work done at home, like, fixing, things around the house and so on. So
That's right, Jonathan. It gives us, that's the silver lining, right? We get to do a little bit of chores and around home.
Exactly. Well, hey, the question I was going to ask was, and be honest with you, you answered a lot of it a few moments ago when you had opening. China's been allowed to literally walk all over us. I mean, and we've just basically allowed them to do it, either through our politicians or through the businesses that we've, enabled particular laws for them to go overseas and give our jobs up. I'm glad that you guys have a plan, at least where we're going to at least get something started where we don't have to worry about this anymore.
Ambassador, why don't you start with your thoughts on how we can hold China accountable?
Sure. Well, let me just start out by talking about President Trump and his platform in 2016. If you remember, he wanted to secure our borders. He is securing our borders, and he wanted to have control of our own manufacturing, because that is a national security issue. Understanding China and understanding that the U.S. needs to have control of our manufacturing. I think that this has really paid dividends. The fact that our country economically was doing so well when the virus came over to America, that has helped us to be able to mitigate our economy. We've got, the president made it very clear that he wanted to see the industries and people want to move all of their manufacturing back to America. So if not for Donald Trump thinking ahead and knowing that we were going to make America great again, and it is great, then we wouldn't be where we are today as far as knowing that we will be where we were. So that, number one. The second thing is obviously we know that the damage to our economy and the health is strictly because of this virus, and that virus originated in Wuhan, China. The Chinese Communist government, it absolutely was not transparent. It did not focus on others in the world, making sure that they were helping to mitigate this virus. Every day I'm reminded by the WHO and the lack of transparency from Dr. Tedros and the information that they did not share with us. And I'm reminded of this daily in the Security Council. And I think it's just really important to know that the President saw this immediately. We are no longer going to be contributing to the World Health Organization where we put a pause on this, because we want to make sure that the linkage between our health system, the medical research, all of the outbreaks, all the responses, that we take care, and that is no longer a lull, or there's no longer not being transparent in helping us to be able to mitigate the next virus. Because as I said, Jonathan, there will be another virus. And I think that we're better people because of what we've had to go through, but we expect transparency, because we would give transparency to other countries had the same thing happen and something originated us. And there should be no more mishandling of information on our watch, on President Trump's watch, and I can guarantee you he has our back. He is every single day reminding us that this originated in China, and he's doing everything in his power, along with Congressman Barr and Leader McConnell and all the governors throughout the United States, to bring this country back to where it is. And I can promise you, on his watch, we will see this through together.
And Jonathan, we want to work, and we will work with President Trump and Ambassador Kraft and the administration in countering malign Chinese activities related to this pandemic. That's why I've called for a bipartisan, bicameral investigation. We have multiple lines of effort investigating China right now, including the intelligence community. Many think tanks and private sources are researching what China knew, when they knew it, how they enabled the spread. But I believe those lines of effort should be consolidated into a single congressional investigation similar to the 9/11 Commission to get to the bottom of this. The American people deserve answers. Over 57,000 of our fellow countrymen have died because of this. We've borrowed and incurred an additional $3 trillion added to our national debt. Our economy went from the envy of the world, the strongest economy in 50 years, and in only a matter of a few weeks, really, we have 26 million Americans out of work. So China needs to be held accountable. The American people deserve answers for this, and we know China lied from the very beginning about this. We know that, for example, Dr. Li, who was an ophthalmologist in Wuhan, he sounded the alarm early, and he told his fellow physicians that he was observing a very dangerous pathogen ripping through the hospitals of Wuhan, and he warned his fellow physicians to protect themselves with protective gear because of this very contagious virus. And what do we know China did? The Chinese Communist Party arrested Dr. Li, who later died of the virus, and they made him sign a statement recanting. And they used the Chinese Cyberspace Administration to silence and censor all of the social media that was reporting this. They locked up. They stopped all outbound travel to other parts of China from Wuhan, but they allowed international travel. All the while, they were denying human-to-human transmission, and they allowed the World Health Organization to repeat that lie over and over again. And we know that from the State Department 2 years ago, diplomats from the U.S. Embassy in Beijing went to that laboratory in Wuhan. They looked at it, and they were alarmed with what they saw. They reported back in 2 sensitive but unclassified cables to the State Department that they were not using the necessary safety protocols, and they were worried about the lack of training of some of the scientists and researchers in the laboratory. And so either there's something to this theory that the virus originated from that laboratory, either negligently or intentionally, or it's one of the greatest coincidences of the last century that you would have this global pandemic originate just within miles of this laboratory that was investigating, of all things, coronaviruses from bats. So it's very clear that China has culpability here, and there's many things that Congress is looking at to supplement the great work of the administration and pushing back. And I had a conversation recently with the National Economic Council head, Larry Kudlow, about what we're going to do, Congress in concert with the administration. But one of the things I know we have to do is we've got to relocate these supply chains back to the United States. China right now has a market share of about 80 to 90% of all the chemicals and raw materials for medicines and generic drugs in the world. And that is a national security threat to the American people. We have to ration in the United States because of shortages, and it's really chilling to hear what the Communist Chinese Party was saying after the outbreak. They were saying that, and they were threatening the United States that they were going to withhold these critical drugs, generic drugs like some of the anesthetics and the sedatives that are used to treat intubated, ventilated patients who have coronavirus, that they were going to, quote, throw Americans into a sea of coronavirus by depriving Americans of the antibiotics and the sedatives and the generic drugs that they manufacture. So one of the things we've got to do right away is we've got to relocate the supply chain of drugs and pharmaceuticals back to the United States to counter this deliberate strategy and malign activities to threaten the United States and our health. We also need outbound investment review. We need to look at American capital investment in China that would undermine our efforts to relocate the supply chain here. We don't want American investment in critical industries in China that bolster our dependence and over-dependence on China and Chinese supply chains. And certainly with PPE, what we know is that after the outbreak, and as the virus was spreading across the world, they began to vacuum up all of the critical personal protective equipment, the masks, the gloves, the N95s, the gowns, and they attempted to gouge Americans with this. So they really need to be held accountable here, and we're glad that the administration is taking this seriously.
Okay, our next question is from Edith in Irvin.
Hi, Edith.
Hi, hon. My question is, what happens if they open back up the United States too soon? There's going to be another outbreak and probably be worse than what it was the first time. Am I right or wrong on that?
You know what, Edith?
Go ahead.
I think that's a good question. I think that's a really great question, and I think we have an obligation. We have a personal responsibility, and I know Congressman Barr would agree that each of us has a responsibility to make certain that we follow the guidelines and that we continue the social distancing and we continue, being very cautious and very careful in our interactions with people. Each governor is going to be making a decision based upon the information that they're given from their task force in each state, and each state is watching very closely Congressman Barr and the White House task force. Everyone's going to be taking a chance, Edith, you're right, and it really is going to be every American working together, and it's not going to be easy, and it's not fun, and it's, nobody's having fun right now knowing you can't go out and knowing, but at the long term, if we just keep close attention and keep following the guidelines, each state will make it through. So that's a great question, and Congressman Barr, I think that you're probably better equipped to speak about this from a United States standpoint about mitigating once the states do open up. So I'll defer to you on the rest of that.
Thanks, Ambassador. And yes, Edith, that is a great question. I know it's frightening. This is a frightening situation, and we all need to continue to exercise that social distancing and wearing masks if necessary, especially if you are sick. That's what's recommended. And there are guidelines that the federal government has released, a 3-phase reopening strategy. The good news, and what will enable us to safely, consistent with public health, reopen our economy and resume some semblance of normalcy without a resurgence of the virus, is that we're making great progress in both diagnostic testing and the deployment of that testing, and that's improving every day, making sure that our hospitals are not in a position where they could be overwhelmed, meaning that they have the personal protective equipment and the technology, like we were talking about at the beginning, to handle additional cases that might occur. But most importantly, that we are in many clinical trials right now of very promising therapies. A vaccine is probably not sooner than a year away, but the therapies, meaning the medicines and the treatments that can make this a much less frightening illness, very promising. We have over 70 therapies or medicines that are in clinical trials right now, some of which are very, very promising. And there are 211, I believe, that are also being prepared to go into clinical trials. And we're going to be looking at some of the results of those clinical trials. We have, for example, in Lexington, Kentucky, we have epidemiologists, infectious disease doctors who have worked with the Kentucky Blood Center to work with convalescent patients who have recovered from COVID-19, who have donated their blood plasma, and that has been injected into critically ill ICU patients on ventilators, and those patients have recovered because they have the antibodies injected into their systems. Now, that's not widespread use, and it's still fairly experimental, but the early results are very, very promising. And so what that means is that even if you contract the illness in the future, there will be much better treatments of it. Nobody wants to get this. Nobody wants to have to go into the hospital and get this treatment. But if that were to happen, I think the therapies that will be more readily available to people will be much better, and it will make it a much less frightening situation.
Okay, our next question is from Patricia in Frankfurt.
Good evening.
Good evening.
My question is twofold, and you've spoken to this a little bit in that how do we trust China when they own companies here in America and have access to our food chain, like Smithfield Meats, and companies within the states that can close. Also, how do we know true numbers when the doctor who I forget her name that is with the president each evening? How do we trust the numbers when every death is considered a COVID death going forward?
Well, good question. I'll be happy to take the second one. Ambassador, do you want to talk about China and how difficult it is to trust China with anything?
Yeah, I think that obviously it is a rippling effect. I mean, this virus has a rippling effect, and we're talking about food insecurity. We're talking about food availability. I mean, that I'm seeing different leaders throughout the emerging countries reaching out to me, and their biggest concern with this COVID-19 is their food insecurity. And a lot of the countries have taken aid from China in the past, and they also see that there's that lack of transparency, which is obviously makes you not want to trust someone. So therefore, we are trying to help this process so that we are trying to teach them how to be sustainable. I mean, we are giving billions of dollars in aid around the world, and especially in the countries where they already have issues with starvation and issues with health care. But this has only amplified the insecurities that they're having right now. So that's a great question. We are working day and night as the United Nations, the Secretary General, on trying to figure out ways that we can go in and help countries to become less dependent. Obviously, each country's needs are different. Each country's relationship with China is different, and we have to be very delicate. But at the same time, I think that the world is waking up and the world is acknowledging that China was not forthcoming, that they have not been transparent, which has been, misled all of us and has caused great damage. So I think you hit up on a really important topic, and food insecurity is going to be something that we're not only going to be dealing with today, but this is going to be a lasting effect because they already have it anyway. This is going to be adding to it. And thank you for that question because it reminds me every day is when I'm talking about Yemen and Syria, the dire needs they have, and it's only going to worsen. So thank you for raising that issue.
And I would just add that this is Andy. I would just add that we cannot trust the communists in Beijing. We cannot trust anything that they say because they have a record of lying and deceiving us and covering things up. And so what I would say is what we have to do is we have to defend the United States by relocating our supply chain and decreasing our dependence on China, and that comes in many different forms. We cannot out-subsidize the Chinese. In other words, they can always overmatch us because they're a communist central government. They can always overmatch us on subsidies. I think tax incentives would help, but they wouldn't be enough because of their subsidies of state-owned enterprises, where basically we can no longer make penicillin, aspirin, or vitamin C in the United States because what they do is they dump their cheap drugs and generics into the global market to put those U.S. companies out of business. So not only do we need tax incentives to bring that back, but we need, to think of a deliberate strategy in terms of long-term contracts with the Department of Defense, the VA, the Strategic National Stockpile to bring those businesses back. But beyond that, I think we need to develop, a private sector supply chain to bring these kinds of generic drug-making efforts back to the United States and also other things. The final point I would make is it's not just about the supply chain. It's also about forced transfer of technology. And so if sometimes we'll see China invest in an American company like Smithfield, and it's really not a benign investment where they're just providing capital to create jobs. What they're doing is they're actually taking over a critical industry. Sometimes it's maybe a semiconductor, or maybe it's real estate that is in the proximity of a U.S. Army base. We cannot trust those investments, and so we have a multi-agency review process called CFIUS, or the Committee on Foreign Investment in the United States, and it also looks at joint ventures between U.S. companies and Chinese companies where they're stealing our intellectual property, they're stealing our critical technology that could be used, frankly, by the Chinese Communist military against us. So there's a lot of things we need to do in addition to bringing back our supply chain. We need to deter the Chinese with a strong national defense, and we need to review these malign investments into U.S. businesses that can result in the transfer of technology or intellectual property.
And don't you think, Congressman, that that the companies that were affected immediately, that were American companies that also were located in China, are now starting to rethink their strategy, whether it's Apple, whether it's Starbucks, whatever company it was that has been hit the hardest. I think they're very smart to start rethinking strategy and looking in different ways. And obviously we have countries, look at Taiwan, look at how successful they have been. Look at Japan. We have countries that have done this the right way, and that economically will be countries that we'll be looking into for investments. And I think that
absolutely,
we need to be very firm about this. We need to never forget it because this has affected all of our manufacturing. And as you know, President Trump ran on this in 2016. Let's bring our manufacturing back to America. And I
Absolutely.
can't think of a better administration that you have done this. You've been part of this, and now is we must now take a very strong look at this. And the people that doubted President Trump when he was running for president in 2016 and wanting to bring manufacturing back, I think now are seeing, thank goodness we did start this process, because look where we are
Right.
today because of it. So
Right.
thank you, Congressman Barr, for that support.
Thank you as well, and I agree with you, and I think many CEOs are rethinking. I think this has been a wake-up call for many of them to see, the Chinese Communist Party saying, because of our dependence on supply chain, saying they're going to throw Americans into a sea of coronavirus. I mean, I think that many Americans are starting to rethink the relationship with China and decoupling, and it couldn't come too soon. And I say that as a free trader, as someone who believes in free trade. But what you have to understand is when you trade with China, it's never free trade, because you're basically not competing with Chinese businesses. You're competing with the Chinese Communist government, and that is why it's never free trade with China, and that's why we need to hold them accountable.
Thank you. Our next question is from Lindy in Lexington.
Is this Lindy Carnes by any chance?
Lindy, are you there?
Must have lost her.
Is Lindy
Kelly?
there?
I am there. How are you guys?
Hi.
Hey, Lindy.
I made it. I'm so excited.
I'm glad you're on, Lindy. We need a CPA to help us here.
That's right.
To really darken the mood, I know. Sorry. Kelly and I have talked a little bit about this, Andy, and how we're struggling out here in the accounting world to get some clarity around the payroll protection program. And I know that Treasury has been working very hard to put out guidance, but I'm going to ask you sort of a threshold question, and that is the 75% test that Treasury put out. 75% of your loan proceeds must go for payroll. Is that a cliff test in that if you don't meet 75, none of it is forgivable? Or is there a proration there? Or do you know, because there's no guidance, that maybe we're working on that?
It's a great question, and as a member of the Financial Services Committee, we're in daily communication with Treasury to get clarity on some of these questions. What I can tell you is that no, it's not a cliff test, and I can't imagine that Treasury would interpret it that way. That would certainly conflict with Congress's intent. The 25% rule, I think the way to, or the 75% rule, I think it's better to look at it from the standpoint, if you read the regulation, I know you probably are working through the regulations, but the way I would look at it in reading the Treasury regulations, the SBA regulations, is focus on the 25%. In other words, not more than 25% of the loan proceeds may be used for non-payroll costs. And so the forgiveness, the guidance on the forgiveness and how lenders are to determine forgiveness, we're still waiting on some of those details. But as you look at the regulations that are out so far, the way I would look at it is not more than 25% of the forgiven amount may be for non-payroll costs. And I would not look at it as a cliff, so that some of the remaining balance may be for non-forgivable, but that non-forgivable portion also could be given back if it's not used for payroll. Keep in mind that the reason for this 75% rule is that, and I know there's some complications with this given the layoffs that have happened, but the reason for the 75% rule is that this program, unlike some other loan programs that we've created, is really designed to keep employees on the payroll or bring them back if they've been laid off. It's actually designed to prevent people from having to go to the unemployment office. And why that's important, we felt that was important in Congress in a bipartisan way, was keep workers connected, even if the business is totally shut down and the employee can't even work right now. Keep that worker, keep that employee connected on the payroll and tied to that employer, so that when we do reopen the economy, those workers will be connected to the employer, and therefore they'll be able to more quickly restart the economy. Keep in mind, if you've got clients who if the PPP doesn't really work well for them because their payroll costs are smaller than the other overhead that they have to contend with, they can give back whatever part of the loan that they're not going to use for payroll, and that exceeds the 25% on the other costs, such as utilities, mortgage interest, or rent. So they can always give it back so that they don't have a non-forgivable loan. Although the non-forgivable portion of the loan is only it's a 2-year term at a very low 1% rate with a 6-month deferral, so it's a pretty good deal. But the other point I would make to your clients would be, if the PPP doesn't work well, you can also look into the Main Street Lending Program or the EIDL program, which can be used for non-payroll costs and expenses. And if you have any questions on any of these things, Lindy, for you or your clients or small businesses out there listening, please do not hesitate to call our office, our business response team. We are there to help you navigate the complexities of these programs and try to get you the help that you need. And Anthony Allen in my office is leading that up, and he can be reached at 859-219-1366.
Okay, thank you. Thank you. And talk to you soon. Bye.
Thanks, Lindy.
Thanks, Lindy.
We've got time for one more question for tonight, and our last question comes from Ellis in Lexington.
Hi, Congressman Barr and Ambassador Kraft. Thank you both for your service. Congressman Barr, as you know, the horse racing industry is very close to my heart, and I'd like to know if there's anything, and Ambassador Kraft, I know as a Kentuckian, you probably feel the same way. Is there anything you might be able to do to help Governor Beshear and maybe with your other colleagues in Congress, other governors, better understand that the multi-billion-dollar horse racing industry in the Commonwealth is really in a unique position to operate without spectators? Is being done in 4 states right now successfully, using protocols, masks, doctors on duty, and social distancing with no cases, so that all participants are healthy and safe.
Ellis Starr, I recognize your voice. It's great to hear from you. Ambassador, I'll let you go first on this one.
You know, I think obviously this has taken, being a Kentuckian, this has taken an economic, it has made an impact. I don't know enough about the actual impact economically the horse racing has made, but I know that you obviously would want for Derby. We're coming up on Derby weekend, and I think when you have people there, when you have the fans, I think that's where the issue is in making decisions. Is how do you allow certain people to come in to enjoy the horse racing industry and yet keep the social distancing. I think right now, because we're still have not hit the peak, that may be the reasoning for the decision. But I can guarantee you that Governor Beshear, you know, being from an equestrian family himself, is taking every precautionary measure and is listening to the experts and is obviously, I mean, this is not pleasant for any of us. I mean, we have a lot of friends in the horse industry, and this is not easy, but everybody also understands that horse racing by itself, the horses and the jockeys and just the essential people at the track, may be something that is being discussed, but it is really difficult to open it up as normal. I don't think we'll be having normal for quite some time. But I have to defer to the governors of each state to be able to mitigate what they think is best for our state. But I also want to acknowledge that we do have several friends in the horse industry, and everyone, nobody likes it. None of us like being at home, and none of us like to change our lifestyle. But if we are going to get through this together, all we can do, we just have to keep monitoring the news, monitoring the virus, listening to the experts, and just keep looking for clarity. And I promise you, we're all going to get there. This is a country that is very resilient. I can tell you, that being around 192 other member states, I am so proud to be from America. So I understand the pain, but when you trust me, I've been seeing pain that I never thought I would ever see in my lifetime by traveling the world, and we are very lucky. So thank you for supporting the horse industry. My father was a veterinarian, so I understand the importance of the horses have to run. I do get that, and I understand the economy, and we always have friends in for Derby, and this year we'll wait for September. So anyway, thank you for your support and for what you do for the state of Kentucky.
Yeah, Ellis, thank you so much for everything you do, and I know what a passionate advocate for the horse industry that you are. And by the way, I'll just point out that both Keeneland and the Red Mile were able to get some support from that PPP program. We had to work with Treasury to get some changes made in order to make sure that they could be eligible, but they are eligible, and it's hard when those tracks are shut down and cannot entertain the business that they normally do. It's tough on the economy. It's tough on our culture. This is such a special time of the year, and it's in many ways very sad that we don't have the Derby this week. But what I think, and of course, public health has been and will continue to be the top priority. I am very optimistic that we're seeing positive enough trends with the public health situation that particularly with the horse racing industry, that industry can open safely. That's just my personal opinion. I come at this as the co-chairman of the Congressional Horse Caucus. I admit I'm a little biased. I represent the horse capital of the world in Lexington, and so this economy is very, very important to us. But I believe that it's uniquely situated to open more rapidly than other sporting events for all the reasons, Ellis, that you pointed out. The fact that you can do it without spectators. Fans can participate from home using ADW platforms and other ways. The television is vacant right now. The only sports that are on TV is The Last Dance on ESPN with, we're rewatching all of those great Michael Jordan teams right now. But think about it. There's no golf. There's no Masters. There's no March Madness. There's not a lot of sports going on. But you can safely, with social distancing, have sports, have horse racing right now, just as 4 other tracks are doing right now. I think it's an opportunity, and I've talked to the folks at Keeneland, and I've heard from the folks at Churchill Downs that we could see summer racing both at Churchill Downs and at Keeneland, and I think do so very, very safely with social distancing if we were going to have spectators. But then certainly the jockeys and the equine athletes, they also don't have to be always in close proximity to one another, and then many participants can enjoy this great sport, from home. And I think you could see a real resurgence while these other sports are not on television. You could see a real resurgence of the thoroughbred industry, which I hope to see. Thanks for your question, Ellis.
Yeah, that's a good question.
All right. Well, we have come to the witching hour, and I'm sorry. I know that there's other callers that wanted to ask questions, and I'm sorry that we were not able to get to your calls. But I am so grateful to Ambassador Kraft for joining us tonight, and I'll let her make some concluding remarks. And again, thank you so much for your leadership and for your service on behalf of the American people and Kentuckians at the United Nations. And thanks for joining us tonight.
Well, it's my pleasure, and thank you for having me, and hopefully we'll be able to maybe do this again before I return to New York and you return to Washington. And, what I'd like to say as closing is obviously we have difficult days ahead, trying to reopen the country, trying to reopen it and also mitigate this COVID-19. But I can tell everybody that's listening that the Trump administration, Leader McConnell, Congressman Barr, I have never seen more committed individuals to play effective roles in trying to help this country navigate these challenges. I have never been so proud of my state and the leadership that we have in our state with Leader McConnell, with Congressman Barr, with Senator Rand Paul, with our governor. I mean, this crisis, as a Kentuckian, I can speak that it's tested us. It's tested us personally. It's tested us emotionally, physically, economically, but you know what? We are resolute. Kentuckians are resolute. America, there is no greater place than to live in America. There are no greater people than Americans. And I know that we are all going to be stronger. We're going to be more resilient. And, you know, we're hopefully are going to hold on to all the silver linings that each of us have seen and have witnessed and have felt. We're going to hold on to that and still be together like families, which some of us have forced to have been together. And I think that if we can take the goodness and the hope that we've all seen, that this country is going to be so much better off. And I can promise you that President Trump, the next couple years, is going to be bringing this country back to where it was when it was at its highest before the virus. So thank you all for having me. Thank you all for everything you're doing. I look to every single Kentuckian, every single American as being somebody on the front line. So each of you in your own way are contributing to making this country, putting it back to where it was, and to mitigating this virus. And I am very grateful that you elected Congressman Barr, and that we have people in our state that truly care. So Kentuckians need to be proud, and I'm very proud to represent each of you. Thank you again. Thanks again, Congressman.
Thank you, Ambassador.
You know what, Congressman? I wanted to tell you that on my daily run, I noticed that you have a nephew that's graduating from Lexington Catholic.
That's right.
So a shout out to, is it William?
Wilson.
A shout out to Wilson. I saw his sign in the yard today because, you know, I've watched these kids grow up. And now they're graduating.
We're proud of Wilson.
And everybody has, so all the high schoolers that are graduating, I'm really proud. I went to public school, Glasgow High School, and I remember how important my graduation was, and I salute all of the graduates of 2020, and congratulations to your nephew.
Oh, thank you, Ambassador. Yes, Congratulations to Wilson. I'm a graduate of Henry Clay High School, and I remember the senior year, how fun and exciting it was, and our hearts do go out to those seniors because they miss their prom and their graduation and all the fun that they typically have in their last few months. But Ambassador Kraft, thank you so much for participating tonight. Thank you for your inspiring words of optimism that really showcase the spirit of America, and I think the spirit of Kentucky, that optimistic outlook, even in the face of this daunting challenge that we have with this coronavirus. But like we always do in the United States, as Americans, we overcome, and we will be stronger and more resilient on the back end. We will defeat this virus, and the world is really fortunate to have America leading the worldwide battle against the COVID-19 virus. Our innovative researchers, our scientists, they are the best in the world, and we are working overtime to find effective therapies to combat this virus. The American private sector is also leading the way in coming through this difficult economic shutdown, and so proud of so many small businesses hanging on and keeping those employees through this difficult time. I encourage all of my constituents to continue good health practices for themselves and their families. Wash your hands, continue to do that social distancing, and I'm sorry I didn't get a chance to chat with everybody on the line tonight, but there will be an opportunity for you to leave me a voicemail if you just stay on the line. Hope you will leave a message and also let me know what you thought about tonight's call. Thanks again for joining us and for the incredible privilege of representing you, your family, and fighting for your interests and values in Washington. Have a great night.
Thank you, Andy.
Thank you.